Good afternoon, everyone, and thank you for joining us. Today, we're going to discuss something that affects nearly every medical practice, but often goes unnoticed: administrative delays. These delays don't just slow down your office, they quietly impact revenue, patient satisfaction, and staff morale, and overall efficiency. Throughout this session, we'll look at common operational challenges and explore practical ways to reduce them. Think of this as less of a sales pitch and more of a working lesson. We want you to leave with real insight that you can apply. When we think of competition, we usually think about another practice opening up nearby. But one of the biggest competitions is actually inside our own practice: administrative inefficiencies. They quietly consume time, reduce revenue, and impact patient care every single day. These aren't small numbers. 9 out of 10 practices say the burden is getting worse, not better. And nearly every single one agrees that fixing it would directly benefit patients. Think about how many patients call your office every single day. A four physician practice handles 200 plus calls daily. Far too many for a single receptionist juggling check ins, paperwork, and patient questions. When someone can reach your practice quickly, most won't leave a voicemail. They'll simply call another office. Every unanswered call is a potential missed appointment, and 125 to 200 per call. Those losses add up fast. A five physician practice means missing just five new patients calls per day, lose over about $144,000 annually. With our virtual front desk, acts as an extension of your practice. Our team answers calls, schedules appointments, verifies insurance, sends reminders, and manages patient messages. This allows your in house staff to focus on patient care while ensuring every patient receives timely and professional service. Think of it as adding a full front desk team without adding headcount or overhead. Referral coordination is one of the most time consuming administrative responsibilities in a practice. Missing paperwork or delayed communication can postpone treatment and create unnecessary frustration for both patient and providers. These delays often occur because staff are balancing many competing priorities at once. And when a referral falls through the crack, the patient may never follow through, which means lost care and lost revenue for your practice, which, in my opinion, I don't think is fair. Our referral coordination team manages the referral process from start to finish. We track referrals, communications with specialists, ensure documentation is complete, and provide updates so patients move through the process more efficiently. Your staff no longer has to chase down paperwork or make repeated calls to specialist offices. We handle that so you can focus on patients in front of them. MD Help Tech manages the authorization process by preparing documentation, submitting requests, monitoring status, and following up insurance companies. This helps reduce delays and allows providers to focus more on patient care. When your team isn't spending hours on hold with payers, they can redirect that time to the patients in front of them and the patients who need the time. Eligibility verification may seem like a small task, but mistakes can lead to denied claims, billing issues, and unhappy patients. Here's what's striking: 84% of denials are potentially avoidable, and nearly a quarter of all denials trace back to registration and eligibility errors caught too late. Verifying insurance before appointments is one of the highest ROI steps a practice can take. Our eligibility specialists verify insurance coverage before appointments, helping practice reduce denials, improve reimbursement timelines, and provide patients with more accurate financial information. When patients know what to expect financially before they arrive, it also reduces billing disputes and improves the overall patient experience. When providers and staff spend too much time on administrative work, productivity suffers. Documentation backlogs, overflowing inbox, and repetitive tasks contribute to burnout and reduce the time available for patient care. Nearly half of all physicians report burnout symptoms in 2023, and administrative burden is constantly cited as a top driver. The good news is that this is one of the most solvable problems in healthcare operations. Our virtual medical assistants provide administrative support tailored to your workflow. They help manage documentations, inbox, and day-to-day administrative tasks so providers can spend more time focusing on patients. Think of it as giving every provider their own dedicated administrative partner without the overhead of a full-time hire. When administrative bottlenecks are reduced, the entire practice benefits. Patients receive faster service, staff experiences less stress, providers regain valuable time, and the practice operates more efficiently. These abstract benefits, they show up in your revenue, the retention numbers, and the patient satisfaction scores. The practice that invest in operational efficiency are the ones that will be the best positions to grow tomorrow. We work alongside your existing team to strengthen daily operations. Our services are designed to reduce administrative burdens, improve workflow, and help practices provide exceptional patient care without adding unnecessarily overhead. We're not here to replace your team. We're here to make them more efficient. If any of what I discussed today resonates with challenges you're facing, we'll love to have a conversation on how we can help. You are more than welcome to come in, speak with one of our consultants, and learn how we go from there. Thank you so much for your time for joining with us, and I hope to hear from you soon.